Hello, everyone. Thanks for joining us on this live today. Welcome, welcome, welcome. Please, as you join us, let's know where you're watching from. Thanks for joining us. Yes, so with me on this episode today, we have an amazing doctor, a GP, all the way from the abroad. Let me leave it at that. So, but we have with me on the live Dr. Joan Ezomo, who will be taking us on the topic nutrition for a healthy pregnancy and how to manage pregnancy cravings. So, quickly, I'll be inviting her as she takes the floor. Please join me as we welcome Dr. Joan Ezomo to the stage. Dr. Joan, thanks for joining us.
Thank you. So,
So,
I will start by saying nutrition is a pretty simple topic, in my opinion, when it comes to nutrition is a pretty simple topic, in my opinion, when it comes to pregnancy. But I feel like it's something that has become overly complicated, especially in recent time with social media and popularizing specific things at a time. So because of this, it's very easy to be hyper fixated on single things at a time rather than looking at nutrition from a more holistic point of view or from a wider viewpoint. Right from our primary school days, we're taught the classes of food from carbohydrates to the proteins, water, fats and oils, mineral salts, and have I said vitamins? I'm not sure. And then we should add fiber because that's the one thing we forget sometimes, and it's actually very important in our day to day diet. So, being a woman of reproductive age who is wanting to have children, the first step is to make sure you are a healthy person because pregnancy is a pretty stressful period where you need to provide for another individual within you. So you need to make sure that you are healthy enough to go through that journey as easily as possible. Proper nutrition makes it a little easier, even though pregnancy in itself can come with its own complications. So in the first step, we need to make sure that we are of a good weight. That's a good place to start. And being of a good weight and also having proper nutrition with balanced diets. In preparation for pregnancy, one of the very important vitamins to think of is the vitamin B9, that's the folic acid. It's something that if you're even thinking, as soon as that thought pops into your head that, oh, I would like to have a baby, folic acid is your friend. You don't need to take it at a very high dose at this point. Taking as little as 400 micrograms every day puts your eggs in a better position to produce a good baby, to put it in simple terms. Ensuring that you are having your daily requirements in terms of calories is also a good idea. Maintaining a good weight, that's so a good way to look at weight is using the BMI, that's the body mass index. It's calculated by dividing our weight in kilograms by the square of our height in meters. So having a BMI less than 19 and greater than 24.9 is problematic. So being underweight or overweight, whichever one it is not, in fact, in this life, anything that is not in the middle is never really the best. So keeping a healthy weight would be having a BMI of about 19 to 20, 24.9, if I'm not making a mistake. Being obese would mean that you have a BMI of greater than 30 or 30 and above. And in that situation, it greatly increases the possible risk in pregnancy, some of them being developing conditions such as diabetes, the gestational diabetes mellitus, that's pretty much pregnancy related diabetes. It also increases the risk of things like preeclampsia, which is protein in urine with raised blood pressure that can then become complicated with things like seizures if it's left unchecked and affects like what's going on in the brain. Other things that could happen are increasing the risk of cesarean sections because sometimes with having the gestational diabetes, which is related to being obese sometimes, you find women having really big babies, and then it increases the likelihood of delivery being through cesarean section. Again, being obese will still lead to other complications such as difficulty in wound healing, and we don't want all of that. So the best thing we can do for ourselves is, as much as possible, to be the most healthy version of ourselves before we step into that, um into the journey of pregnancy. So having a good weight is a good idea. Folic acid, our friend. So moving from there into the pregnancy phase, it's important to maintain a good carbohydrate intake. I know there is this general fear of carbohydrates. I don't know why people don't like carbohydrates, but if taken in the right quantity, it's a very important class of food. It's an easy way for us to have energy. We can have it in different forms. The best way to consume your carbohydrates would be as complex polysaccharides, meaning not as the direct sugars. So, in a way, our body breaks it down over a long period of time, and it keeps our blood sugar stable rather than giving us spikes and troughs. So, maintaining a good portion of carbohydrates all through pregnancy is important. Have good measures of protein. It's also very important. The advice is to have maybe about 2 portions of fish in a week. Have your proteins, be it from plants or animals. That's your beef, your fish, your eggs. You want your beans, you want your nuts. Very important. Important fats are also good too. So having healthy fats, especially from things like low cholesterol oils. You also want to consume avocados. They have good amounts of fat as well. And then the vitamins. Usually, eating good balanced diets would give you a good amount of vitamins, but because of how tricky pregnancy can be sometimes, taking a multivitamin, a preparation of multivitamins, especially those particularly prepared for pregnancy, is a good idea. It gives you the extra vitamins you might need that might be deficient in the food one might consume within this period. Something I think we forget to talk about is fiber. Pregnancy is a very funny period where people suddenly start experiencing constipation, sometimes for the first time. But maintaining a good amount of fiber in our diets could help prevent or at least lessen the possibility of having constipation during pregnancy. And then I know there is this general conception because I think during the introduction it was even mentioned something about increasing portions. So in the real sense of things, for the first 6 months, is it 6 months? Yes, for the first 6 months of pregnancy, maintaining the normal portions you eat is a good idea. It would usually be enough for mother and baby. So the idea of eating for two is something we should avoid because gaining excessive weight in pregnancy can become problematic in the long run because, again, it exposes the woman to complications such as gestational diabetes, having overweight babies, preeclampsia, and whatnot. And then there is also the trouble of weight loss even after pregnancy that becomes very complicated with a new baby in town. So coming back on topic, within the last 12 weeks of pregnancy, there is a slightly increased calorie need, about 200 calories, which in some cases is just pretty much a slice of bread or a small piece of cake. So the amount of food that we need in pregnancy is actually not so much more. But I think what we need to focus on would be the quality of the content of the food. We want to be sure that we're not just having empty calories, like from hyper processed or ultra processed food. We want fiber, we want rich carbohydrates, the complex polysaccharides, we want good proteins, good fats, good oils, the vitamins and the minerals. Something else to think about is what to avoid in pregnancy. So, whenever I have these thoughts because of medical school and all, the first thing that I think of is sushi. But sushi is not the most common thing we eat in Nigeria. So, it's good to know that it's something to avoid, but it might not be a problem in Nigeria because it's just not our regular diet. But something else that I think is more common for Nigerians to ingest is oily fish. Like the Titus fish is quite oily. That's mackerel. Catfish is quite oily. So we don't want to have as much of that as we would normally do. Two portions in a week is fairly okay. This is because sometimes fish can accumulate some heavy metals like mercury. Yes. And we don't want the mother to be overly exposed to such. This is something that I would probably have read as relates to the Western world. So I can't really say for certain if this is something that we would find in our fish in Nigeria. But as a general rule of thumb, the oily fishes, we try to have them two portions in a week at most. And then coming back to folic acid, I don't think we can overemphasize the importance of folic acid in pregnancy because it is important in the formation of the spinal cord, the bones of the back, and whatnot. So, because of that, it's important to ensure that everybody is getting enough of it. If a person is deficient in folic acid and goes on to have a baby, there are the risks of something called spinal bifida, which is pretty much an abnormality in the formation of the spinal cord or in its closure, and then it can lead to things like paralysis in the baby. So there are specific women who need to have more folic acid than others for different reasons. Women suffering from sickle cell disease would need a higher dose of folic acid. Women who are obese, you see, obesity has come again. It really complicates pregnancy. Also, women who are epileptic on medication because some of the medications deplete folic acid in the body. Also, women who have problems with absorption. So women who are eating good food, but for one reason or the other, the nutrients are not being absorbed as they should. And those women would need a higher dose to prevent folic acid deficiency. Something else that should be avoided in pregnancy is vitamin A. So as good as it is to have good portions of food, vitamins, minerals, vitamin A is a very specific vitamin that we want to avoid in pregnancy because it comes with exposure of the fetus to vitamin A can affect the formation process and lead to different abnormalities in the baby. So throughout pregnancy is something that I think is quite stressed to women. Vitamin A should be avoided, and a very rich source of vitamin A in the diet we have in Nigeria is liver. So that's something that should generally be avoided in pregnancy. Something else is pasteurized milk and some kinds of cheeses. So I'm sorry, unpasteurized milk. I should correct that. Unpasteurized milk. It's not such a common thing for Nigerians to drink unpasteurized milk right now, but some parts of Nigeria, unpasteurized milk is, should I say, a delicacy. So that's something to be avoided because it exposes the mother to certain organisms such as the mycobacterium bovis. Yes. And it can lead to atypical infections that could affect the mother and the baby. And then coming down to the delivery, all this while the woman has been pregnant, I'm assuming she has continued to maintain a good diet with good amounts and quality of carbohydrates, good amount of proteins, fats, and all, has delivered a healthy baby. Something that most babies would be given would be vitamin K because they come quite deficient of it. It's something that would help to prevent bleeding. So that's something I think is worth mentioning. Um, to add to all of this, pregnancy cravings, very interesting topic. In fact, when I was given this topic, it was geared a little towards cravings, and I found it a little funny because cravings are so personal and so varied that I don't think we can fully even understand where they come from. Because when I talk to some people and they tell me this is the cravings they have, or this is the craving their wives had, I find some very hilarious, from the bottom part of their jollof rice to only wanting to lick ice block or to have ketchup and rice. It's very random. So it's not something that could fully be explained. But at that point, the pregnant woman wants to eat what she wants to eat. And in all honesty, as much as it is not something that would harm the baby, please let pregnant women eat what they want to eat. It's a pretty stressful time. So allow them. Exactly. But something to note is, as much as pregnant women should eat what they want, it is very easy to go down that very slippery slope into eating things that are not the best. There might be cravings for the hyper processed things like very processed drinks, like not necessarily fizzy drinks, but drinks that have a lot of sugar, or crisps, or snacks, chips, biscuits, and all those things are fine in moderation. But when it becomes a constant thing, it could then lead to the pregnant woman gaining far more weight than she should, and that becomes a problem. So, as a general rule of thumb, I would advise that where possible, the less calorie dense form of the cravings should be pursued. So, if a lady wants to have biscuits and she has the opportunity to have a low calorie version of it, she should go for that over the higher calorie one. Same thing with cakes. Nowadays, there are so many delicious recipes we can get on YouTube where should I say, well selected ingredients are used to make the same delicious things that we want, but at lower calories or being less calorie dense. So those options should be pursued rather than the higher calorie ones. And then where possible, fruits, very important. Fruits are very good in pregnancy. They usually don't contain so many calories and they can really help with cravings. And just to put all this together, pregnancy again is such a crucial time in the life of a woman, her family, and even in the life of the baby yet unborn. So maintaining good nutrition during this process, during this phase, would help produce the best possible outcome for both mother and child.
For both
Thank you.
mother and child. Thank you. Thank you very much, Doc. In fact, I'm so happy we blended this topic with pregnancy cravings, right? Because,
Yeah.
as you were talking of all the healthy things to eat in my head, I was just really thinking of the fact that, in all honesty, though, maybe just saying from my own experience, the reality of pregnancy is there are some things you are not just able to eat, even
Yeah.
if they are healthy, right? Because of nausea, irritation, and then a whole lot of changes, right? So sometimes it comes down to what your cravings will permit,
Yes.
or like I say, what you can tolerate in that
Yeah.
season. And so it really dwells on heavily on the cravings, just saying that generally, though. But then I'm happy to know that, okay, even on the healthy side, we should not eat liver. Like, I
I
was
think
not,
I found
I
that
think I
very
found that very
because when I
because
think of
when I
pregnancy,
think
I
of
think of things like
things
carrots,
like carrot,
well, but to
uh,
see what
to
liver is
see what liver is
high content
like
can
content
be good,
can be.
I found that very
Okay. I
surprising.
found that very surprising.
Yeah.
Okay. Okay. All right. Then the processed food. Well, we are going to take your advice as much as thank you so much for sharing with us, Doc. So, a quick question though. Now, you talked about fruits, right?
Yeah.
And then yeah, something on my mind is this. I remember I saw this stuff when I was pregnant about pineapples, that pineapples can cause, what's it called? Can cause miscarriage. You should avoid pineapples, you should avoid unripe pawpaw and the rest. Can you please shed light on that? Because I noticed that for me personally, I couldn't tolerate so many things, but pineapple was one of them that I could eat, pineapple and orange. So I think because of that information, I just avoided pineapple and was taking orange, which was fine. But I would like to know more from a medical perspective what you really think about that.
Okay. So I thought this
Okay.
question will
So I
come.
thought this question will come.
But the thing I would
But the
say
thing I would say about
things like
things like
pineapple or ripe,
pineapple or rice,
um, there is
um,
this particular pepper
one
spice.
particular pepper spice.
I can't remember what
I
it's
can't
called,
remember what it's called,
but that's another one
but
that
that's another one that
I
I
mentioned as being
mentioned as
abortifacient,
being
meaning it
abortifacient, meaning
could increase the
Okay.
risk of premature labor,
premature labor,
miscarriage, and all.
and
So
all. So
this particular
this
food have not
particular
been
food have not been
fully studied.
fully studied.
So that is a major
So
problem
Okay.
that
I found doing my
is
preparation for this discussion. There's a lot of folklore
a
and
major
folklore
problem.
with, our mothers tell us these things, but in all honesty, there are no very
Uh,
clear-cut research work done on them stating that these things are abortifacient. So I
efficient.
would say
So
take
I would
the
say
advice,
take
because
the
when it
advice
comes to pregnancy,
because when it
pregnancy
comes to
is
pregnancy,
very, very
pregnancy is
personal,
very, very
and
personal.
there is the risk
And
of
there is the risk
doing
of
things that
doing things that
you might look back on
you
and
might
feel
look
like
back
if
on
I
and feel
didn't
like
do
this
it,
didn't do this,
the pregnancy might have
the
been easier.
pregnancy might have been easier.
So I would say take the
So I
advice,
would
but
say
take it
take the
with a pinch
advice
of salt, because a lot of
because
things that
a lot of things that
I
I
do in Nigeria have
do
not
in
been
Nigeria
tested.
have not been
So it's very
tested.
difficult to
So it's very
categorically
difficult to
say this
categorically
is
say
right or this is wrong.
or
So
this
I
is
think
wrong.
it's
So
something
I
worth
think it's something
looking into
looking
in
into
future.
in
It's definitely
future.
a
It's
field for
definitely a field for
study and
study
research to be
and
done.
research to be done.
Okay. Okay. All right. Thank you very much for that.
Okay.
I really appreciate that stuff because okay, okay. I really appreciate that because I observed that I just stayed away from me, right? And the orange I took was fine.
Mhm.
And to be sincere, Doc, okay, were you saying something?
No, no, I'm listening.
No, no, I'm listening.
Okay, okay, so, okay, there's a question from the audience. This question says, what food should I be eating to make sure my breast milk is nutritious for my baby? And
Oh,
are there
okay.
any foods I should avoid? Okay, so one of our viewers is asking, what foods should a pregnant woman eat to ensure that the breast milk on the woman that is lactating, if I'm not wrong? So you have given birth, this woman has given birth, what should she take for breast milk for the baby, and what should she avoid as a woman who is breastfeeding too?
Okay.
Can you please throw light on that?
Yes. So in terms of so when I saw the question pop up, I had just seen the part that said foods that one should eat for breast milk, but I hadn't read um the full question. But thank you for
Thank you
pointing
for
it out.
pointing it out.
There's something
There's
about breast
something
milk.
about breast
It's one of the very
it's one
special
of the very special
that the body
that the
produces.
body produces.
So breast milk is so special that it changes
So breast
with
milk is it changes
so as the baby grows older, the breast milk
baby grows
content continues to be modified to be
so
nutritious
that the
to
breast
the baby at that stage.
modified.
So as much as there is importance of maintaining good quality
Oh,
food.
I didn't.
Hello. Hmm.
Nutritious state.
Doc, please, can you say that again?
Okay, so I was saying that when I had initially seen the question, I
Initially
didn't read it fully, so I didn't see the
seen the
about the
it fully, so
nutritious,
I didn't see about the nutrition.
like what to make the breast milk nutritious. So thank you for pointing that out. I was
Pointing
saying
that
that
out.
breast milk is one of
I
the
was
very
saying that breast
crucial
milk is one
products
of the very
the body
vital
produces
products
because
we produce because it
it is
is
dynamic. So breast milk
dynamic. So
is
breast milk
different from breast milk
is
at
different from breast milk at
first week, is different from breast milk at 2 months,
breast
is different from
milk
breast milk
at
at
2 months. It's different from breast milk.
The breast milk keeps changing as
The
the
breast
baby
milk keeps changing as the baby
produce what the baby needs at
produce
that.
what the baby needs at that time.
So
Oh,
what
really?
the
So
mother
what
needs to
the mother
maintain a generally
needs
good
is
nutrition. It's not
fairly good nutrition. It's
to
not to
pick and choose
to
this will make the breast milk
pick and
yummy
choose
because this will
this will
make the
make the
breast
breast milk yummy
milk.
because
That's
this will
not
make the
really
breast
what is
milk.
needed.
That's not really
What
what
the mother
is
needs
needed.
is to maintain
What the mother
good
needs is to
nutrition,
maintain
good
good
carbohydrates,
nutrition,
good
good
protein,
carbohydrates,
good amount
good
of
protein,
vitamins, minerals,
good amount
and
of
so
vitamins,
on.
minerals,
But the
so
body
on.
would naturally
But the
change
body will naturally
to
change.
suit the baby. But having that
But
at the back of the mind, there are certain foods that would help
um,
produce more milk than others. Like there are certain foods that mothers are encouraged to eat to help with the production and not necessarily the nutrition because
it's really the
the
nutrition
body
because
lost that part. The
body
body will
was
take
part.
whatever it
The
needs to
body
feed
will
the
take
woman.
whatever it needs to
That
feed
is
the
why
woman.
I think there was
That
a
is why
period
I
in
think there was
social
a
media
period
where there
in
was a
social
trend
media
of
where
people
the
making lists
trend
of
of people making
things that
lists of
happen to them when
things
they are
that happen to them when they are
breastfeeding,
breastfeeding,
things like losing teeth,
things like
breaking
losing
bones.
teeth,
So if the body needs
breaking
calcium
bones,
and the mother's nutrition
and
is not as rich
the
in
mother's
calcium,
nutrition is not as
the
rich.
calcium will come from
The
somewhere,
calcium
no
will
matter
come
what
from
it is.
somewhere, no
So
matter
what the
what it
mother
is.
needs
So what the
Wow.
to
mother needs
maintain good
to
nutrition
maintain
for
good
herself,
nutrition
and then the breast milk will produce.
for her
So for the things that help
but for
in
the things that help
increasing milk
in
production,
increasing milk
that things
production,
like
there are things like
oat is a very, very popular, easy
what is the
source of
source of
nutrition for breast milk
nutrition for
production.
breast milk production.
So foods that help with
So
breast
foods
milk
that help with
production
breast milk
are called lactogenic
called
food.
lactogenic food.
So
So
oat is a very good example.
oat is
Not
a very good
all food.
example, not all food.
So green leafy
So
vegetables
green
are
leafy
ugu, are
vegetables
purple, are green,
are
whichever name we call it.
green.
Egudu, they are
Whatever
all
name we call
very
it,
good to increase milk
yeah.
production. And then, as a general rule of thumb, the things to avoid are alcohol.
Increase and
Alcohol
alcohol.
is equal to sip into breast
And
milk.
alcohol
You
is
don't need
able
to
to
put
sip
in the
into
breast
breast
milk.
milk. You don't need to put in the breast
Caffeine
milk.
as well. So
Caffeine as well. So
though women can have
though
some level of caffeine
women can have
intake, it is advised that they don't have too much of it. There is a
caffeine,
certain number at the
there
back
is
of
a
my mind, I
certain
think
number
it is
at the back of my mind. I think
200
it is
mils. That's about 20.
200.
I'm not very sure at
That's
the moment.
about
So
20
doing things in moderation is always a good idea. But you see that alcohol, it should be avoided. You don't want it at all because the baby needs to grow and
for
exposing the
sure.
baby to alcohol
The
can
moment be
bring about different complications from things like respiratory
and it's
and
for
depression to
temperature
it's like, giving your baby alcohol. Why would you do that? So it's something that should just be avoided. Yeah.
and very avoided. Yeah.
Okay. Thank you very much for that. I'm really just learning that breast milk changes with the development of the baby to provide what
Wow.
the baby needs. Wow.
And just to point,
In fact, I
And
I
think
just
feel
to
like
point,
it's something you
I
probably
feel like
know,
it's something you
you might
probably
not
know,
have thought
you
about
might
because
not thought
thinking
about
about
because
it, I'm sure
thinking
everybody
about,
has
I'm
heard
sure
of
everybody
colostrum.
has heard of colostrum.
That's
sorry.
the I'm saying almost
I'm
everybody has heard
saying
of
almost everybody has heard of
Of what?
colostrum.
colostrum.
Yes, 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 yes.
Exactly. So colostrum is the
Exactly.
first
So
breast.
colostrum is the first breast.
It is rich in
It is
antibodies
rich
that
in
will protect
antibodies that will
the
protect
baby
the baby
from infections.
from
But it
infections.
happens only
But it
in the
happens
first
only
few
in
days
the
of
first
birth,
few days of
and
birth.
then it's no longer
And then
there.
it's
The
no
breast milk
longer there. The
changes
breast milk
to
Mm,
changes
another
to
form.
another form.
The way the
mm,
The
colostrum
way the
changes to
colostrum changes
something,
to something else,
the breast milk
mm,
the breast
continues
milk
to change,
continues to
varying
change,
in
varying in
protein,
protein,
content, the
content,
sugar content,
mm,
and
the
all,
sugar content, and all.
based on what the baby
mm.
needs.
What baby needs.
Okay, but then this breast milk we're talking of, from observation, personally, I observe that there are times when it is thick and there are times when it feels very light. So in my head, I'm like, is it based on what you have eaten? Because, or is it based on the formation, because this thing I'm talking of is it can be within the same day, oh, but like in the morning it will be very thick, then in the evening it will be very light, and when it's very light you feel like, oh, the baby is not getting enough nutrients in that breast milk. Maybe you need to drink tea or
Ah,
whatever you need to take to make it thicker or something.
okay.
So
Okay.
So a good way to look at
So
it
a good
is
way to look at it is
you.
you.
In the morning, maybe you had bread and
In the
tea.
morning, maybe you had bread and
Then
tea.
sometime around 12, 11, you got thirsty and had water. Then in the afternoon, you had eba.
In the
And
afternoon, you had eba. And
and then, you got
and
thirsty
then,
again, you drank
you
water.
got
And
thirsty
then
again,
in the
you drank
evening,
water.
you just said, oh, I'm going to have fruit. And then you had fruit and had some more water. That is still how breast milk is. Imagine only giving the baby that thick milk. And then what? So there is a little variation
So
in
there is
breast
a
milk
little variation
a day, such
in
that
breast
at
milk
some point, the
day,
baby,
such that at some
should I
point,
say,
the
thirst
baby
is being quenched at that point. At other times, it's more
like
nutrient dense. So
times
there is
it's more
still within the same
nutrient
food.
dense. So
There is
there
a variation in how breast milk would be produced to
would be
suit the
produced
baby's need.
to suit the baby's need.
So that's a good way to look at it.
So that's a good way to look.
okay, there is so much network interruption. I didn't
Um,
really get that.
okay,
Please, if you don't mind,
no, I don't
let
mind
me
at
say it
all.
again. Okay.
Yeah, so I was saying that it's almost like the way within one day you could have a really dense meal in like in the morning and then in the evening you have something lighter. You get to choose what you want to eat based on how hungry you are, something like that. So even within the day there can be variations in breast milk so that at some point it's more, you know, concentrated and at other points it's more fluidy. But in the end it's what the baby needs. And that's why thinking about breastfeeding is a oh, this is network.
Oh, this
Mhm.
is network.
Yeah.
Yeah, sorry. So I was saying
Yeah,
breastfeeding
sorry.
is
So I
a
was saying
whole
breastfeeding is a
different
whole
topic because
different
very,
topic
very
because
deep, in my
very
opinion.
deep, in my opinion.
Um, it brings us to conversations
It
like
brings us to
exclusive
conversations
breastfeeding,
like exclusive
where the
breastfeeding,
baby has to be fed
where the
on
baby has to be
demand.
fed on
So
demand.
if
So
you are to feed a baby
if you are
breast
to
milk
feed a
only
baby
all
breast
through the
milk
day,
only all
on
through the day,
demand, it would
on
mean that the
demand,
baby will
it
get
would mean
what
that
it
the baby will
needs
get what it
every
needs
single time.
every single time.
So, if, for instance,
So,
the breast
if,
milk
for
now is
instance, the
more
breast milk now
fluid,
is more
containing more
fluid,
water,
containing more water,
and then the baby,
and then the baby,
suckles and empties the breast,
suckles and empties the breast,
and then the baby
and
cries for
then
food
the baby
again
cries for food again
and has the
and
thicker,
has the
more
thicker,
nutrient dense
more
breast.
nutrient dense breast.
It is very likely that
It
the
is
baby
very
will
likely
take
that the
place
baby
for
will go
longer
through for
because,
longer because,
in a way, that's
in
almost
a
like
way, that's
eating
almost
a
like
meal as
meal
opposed to just
as
drink.
opposed to just drink.
It's
It's
That's the way I
that's
think
the
of
way
it.
I
Not
think of it.
necessarily the
Not
way it
necessarily
is,
the way it is,
but it's
but
something like
it's
that.
something like that.
Okay.
Ensuring that
Ensuring
within
that
the day, the baby is getting
the baby is
all
getting
that he or she
all that
needs
your she
to be nutritious.
to be nutritious.
Okay.
Yeah.
Thank
Or to
you
be
very
nourished.
Or to
much.
be nourished.
Thank you.
Okay. Thank you very much, Doc. I believe
Thank you.
in what you said. In fact, I feel like I need to go and get more knowledge on that, especially when I'm pregnant next time, because this
Oh,
breastfeeding of a
Oh,
thing, it was one thing that was just taking me back and forth with the whole the baby needs to eat this, he needs to eat that. And like I said, I was observing too, oh, it's thick now, it's not thick. And funny enough, personally, I don't eat much. So it was a big deal for me. And so it's one of the things I want to do better just going forward. So back to the
sorry,
I'm
just to put
sorry,
this
just to
out
put
there.
this out there.
okay.
Unlike pregnancy,
Unlike
where
pregnancy,
you're
where
doing your
you're
normal
doing your normal
needs for the day would, take you
today
through
would
almost all of
take you
pregnancy.
through almost all of pregnancy.
Lactation is a little different.
Lactation is a
You
little
need more
different.
calories.
Okay.
I think you need, is it 1,250 calories more? I'm not very
Calories,
sure that number, but
calories more. I'm
about
not
that.
very sure number, but
So you need more. And like
Okay.
I said,
so
if
you
you are
need
not
more. And like I said, if you are not
the nutrients will be pulled out from
The
somewhere.
nutrients will be pulled out from somewhere.
Wow.
So you need to keep
So
yourself
you need to keep yourself
so that you don't end up
Yeah.
being the one in deficit because the baby will
in
get
deficit because the baby will get.
Yes.
yeah.
Yes. I believe this thing you're saying strongly, and I think I had a personal experience of that thing you said about women that started talking about how the body changes they're experiencing in the course of breastfeeding.
Oh,
It was something that informed me of the need to look into what I was eating in the process of trying to breastfeed and all, because something I wasn't eating well and I was feeling it in my own body, the whole stress of the breastfeeding and the rest. So,
oh,
but then back to the conversation we're having, we'll probably have another conversation for breastfeeding because it's a whole topic.
yeah.
Healthy nutrition for a healthy pregnancy. I don't know if there's any other question from the audience. I'm trying. So, Doc, are you? Can you hear me?
Yes, I can hear you now.
Can you hear me?
I can.
Yeah.
Okay, okay. So I think we'll be rounding up now. We don't have any other questions from the audience. And then you basically covered all that I would have asked, considering what is healthy and the reality what we can eat too in the course of pregnancy and all. And so thank you very much. I don't know if you have anything to say in a wrap to women that are currently pregnant and are battling with pregnancy cravings. Okay, I was going to ask a question though. When it comes to unhealthy cravings now, women that crave things that are not food material, what do you have to say about that? Because obviously you cannot follow that cravings to start eating sand or chalk or the rest. So what do you recommend?
Okay. So sometimes those
Okay.
funny cravings
So
actually
sometimes
come
those funny
because
cravings actually
the women are
because
deficient in some
the
minerals.
women are deficient in some minerals.
So
Okay.
as a
So
general rule,
as
something
a
we say
general
after doing
rule,
this kind of
something
thing
we say
is,
after doing
first
this
off,
kind
if
of
you are thinking
things.
of getting
First off,
pregnant,
if you are thinking
see
of
your
getting pregnant, see your
lead up and have a
leader
conversation to
and
start
have
with.
a conversation that
As
way.
soon as you find out you are pregnant, you need
As
to
soon as
book.
you find out you are pregnant, you
To
need to book.
prevent the
To
hospital,
prevent
some
the
prefer too
hospital,
early to book, to give
early
you
to
the
book,
time to come back
to give
to
you the
book,
time
and
to
then
come back
run
to book.
some necessary tests at the booking
Then
point
run
because
the
some of
booking
those tests,
point
your blood
because some
levels,
of
you
the
check your mineral levels, would help. There are some certain tests that are done just to be sure that you're not deficient in things like
blood
iron.
minerals and things
So
like
doing that should help with some of those cravings because, like I said, some of them actually materialize from being deficient in some minerals like iron. So sometimes these women who eat chalk or sand, it's something called pica or pica. They are just deficient
that.
in some
They
minerals.
are just deficient in minerals.
And for some, it's an actual craving.
And
Maybe
for some, it's an actual craving. Maybe
eating at some point and light,
in
and
at some point and light, and it's
behind their memory, and then in
behind
pregnancy,
their career and then pregnant
and then they start eating these
and
things.
they
There's
start
also
eating these
that,
things. There's also that,
provided it's not something that would harm
provided it's
the
not
baby,
something that would harm the baby,
it's fine in
it's
moderation.
fine in moderation.
It's always good to have that
Always good
discussion
to have that
with your
discussion
doctor
with your doctor
because
Okay.
because
the foods we
there,
have in
the
Nigeria, there are
foods we
too
have
many.
there are too many.
So there are some that I have
So there
never
are some
tried.
that I have never.
So if somebody were to come to me
Okay.
as their GP
As
to
their
tell me, "Oh, I
GP
want to
to
eat
tell
this,
me,
I
oh, I
find
want
that
to eat it. I find
I
that
always craving
I
this.
always
I
crave
take
it.
it upon myself to
I take
do
it
as
upon myself to
in
do
that
as
sense,
in
and
that
then
way,
give the
and
information I
then
think
give the
that we
information I think
we wait
Okay.
up together
we
and see
wait up together
something
and
what
see
happens.
something what
Because
happens.
in the end,
Because in the
after going
end,
through the throes of pregnancy for 9 months, the best outcome is a healthy
after the
mother
fact,
and a
a
healthy
healthy
baby.
mother
And if the choice is given to any mother to pick between cravings and an unhealthy baby,
to pick between cravings
very
and an
likely that she will
unhealthy
pick the healthy baby.
baby, very that she will pick the baby.
Yeah, that's true. Doc, sorry, one
Mhm.
last question comes to my mind. Hmm?
Yeah.
Now, talking about the supplements taken during pregnancy, like just drawing from my personal experience, right? It was really difficult to keep up. And I will not lie, I was not faithful, like to take all of those supplements. I had packs of the drugs I was given during pregnancy at the end of pregnancy that I did not take. And that's because I was struggling with gas all through the pregnancy. And so for each time, I was belching a lot. And those supplements, by the time you take it and you belch, the the whole thing just irritates me. Like, so the question is this: are there natural sources of those supplements that you can take such that if you are not able to, for whatsoever reason, like if you're not able to, or if someone is defaulting, let's say someone like me now, I'm defaulting, can I beef it up with some natural foods
Okay.
instead of those drugs, okay, or in addition to those drugs?
So, like the names are, they are supplements. They are there supplementing your food. In all honesty, in a pregnancy that is
A
not
fancy that is not
marked by things like aversion to certain food,
version
some people, I think a few people can be that lucky that they go through pregnancy being able to eat every and anything. Those people could go through pregnancy without necessarily needing supplements because they would be getting what they need from food. Supplements become really important in pregnancy because, like you said, at one point or the
because they
other,
would be important in
women
one point or the
would not be able to have meat, would not be able to have
other.
fish, would not be able to have
It would not
certain
be able
things.
to have fish, would not be able
So
to have
having
certain
those
things.
supplements kind of
So
keeps
having
them
those
on
supplements kind of
with
keeps
what they
them
need to ensure that mother and
Okay.
baby
what they
are
need
okay.
to ensure that mother and baby
So
are
I
okay.
don't
Okay.
think
So I
you
don't
necessarily
think
need
you necessarily
a
need
natural
a
supplement for the
natural
supplement that is
supplement for this
supplementing our food.
supplementing our food.
So if we're able to,
So
another
if we're
thing is
able to,
we are
another
advised
thing
to
is
take
we
supplements,
are advised to take
every day.
supplements, every
Missing a
day.
day here and there
Yeah.
doesn't do as much harm as we
Missing
think.
is how
Again,
much
we are
harm I can think of.
supplements. The real thing, we would always advise mothers, where needed, you choose
There
food
are things
over the
you
supplements.
choose food
Supplements are
or the
supplements.
supplements. Supplements are
So
supplements.
in a way, the natural
So in a way, the
alternatives
natural
are already the food.
alternatives are already the food.
Okay, okay. All right. Thank you very much, Doc. This was very real, and I really appreciate this conversation. Thanks for your
Thank you.
time. We don't have
Thank
any
you.
other question
All
from the
right.
audience, so I think it's a night from us. We're calling it a night here. Thank you
Okay.
so much. Please, can we invite you again
Oh, yes, that would be
for
lovely.
another
But I'm not
Yes,
interview?
so
that
sure
be.
when the next one will be. But yeah, I'm happy to come back.
No, but I'm not doing.
All right, all right. Thank you so much. We'll be glad.
Thank
I'll be
you.
glad to do this next time
Thank
with you.
you.
Thanks for your time.
Thank you very much.
Good night.
Thank you very much.
Thank
Good
Bye,
night.
you.
everybody.
Yeah, bye.
Bye, everyone.
Bye.
Yeah.
Bye.
So, guys, thanks for joining us tonight. That was Dr. Joan Ezomo on the topic nutrition for a healthy pregnancy. Please, for everyone that joined us, care to send this live to your friends and pregnant women in your circle, right? It was really educative on the food, on just some little things, right, that can just put you at rest concerning your pregnancy, your concerns for your baby, and yourself in the course of this journey. And so for me, it's a wrap. Please join us next week for another episode on the Ask the Doctor series. I trust we would have more and more real conversations around pregnancy, childbirth, and childcare that helps you have better experiences in the journey of pregnancy. And so for me, it's good night. Have a lovely night rest and a wonderful weekend.